Guys, now we will talk about the organ dysfunction. So, what is organ dysfunction? If any organ didn't work properly and failed to perform normal function, can lead to organ dysfunction. It is a severe form of disease or infection in any organ which can lead to organ dysfunction and can be very life threatening. So, systemic hypotension, interstitial edema, and small vessel thrombosis all decrease the delivery of oxygen and nutrients to tissues that because of cellular hypoxia fail to properly use those nutrients that are delivered. Mitochondrial damage resulting from oxidative stress impair the oxygen use. High levels of cytokines and secondary mediators diminish the mitochondrial contractility and cardiac output and increase the vascular permeability and can lead to acute respiratory distress syndrome. Ultimately, these factors may conspire to cause the failure of the multiple organs, particularly the kidney, liver, lungs, heart, and culminating in the death. The severity and the outcome of septic shock are likely dependent on the extent and virulence of the infection, the immune status of the host, the presence of other comorbid conditions, and the pattern and level of mediators production. Multiplicity of factors and complexity of the interactions that underlie the sepsis explain why most attempts to intervene therapeutically with antagonists of specific mediators have not been effective and may even have had delicious effect. In some cases, the standard of care remain antibiotics to treat the underlying infection and intravenous fluids, pressors, and supplemental oxygen to maintain the blood pressure and limit tissue hypoxia. Suffice is to say that even in the best of the clinical centers, septic shock remain the obstinate clinical challenge. An additional group of the secreted bacterial proteins called suprangiantins also cause a syndrome similar to the septic shock, which is toxic shock syndrome. Superantigens are polyclonal T lymphocytes activated that induce the release of the level of the kines and result in the variety of the manifestations. Thank you so much.